We present the case of a 61-year-old woman with an incidental finding of upper right lobe adenocarcinoma. 4 incisions, 4 robotic trocars, are made between the 8th and the 9th right intercostal spaces. We proceed with an anterior to posterior approach to the hilum and a fissure-less technique performed at the DaVinci Xi Robotic System. The mediastinal pleura is incised and the right upper pulmonary vein, the most anterior structures in the hilum, is identified and isolated with a combination of blunt dissection and electrocautery using a fenestrated bipolar forceps on left hand and the Maryland on right hand. It is important to take care to clearly identify and preserve the middle lobe vein that in majority of cases drains into the right superior pulmonary vein. After complete isolation of the pulmonary vein, the lobe is pulled inferiorly, allowing clear visualization of the main pulmonary artery. A small hilar lymph node located between the pulmonary artery and vein is isolated and removed. Pulmonary artery is revealed by dissecting the overlying pleura, lateral to the superior vena cava and on its upper and lower margin. The right upper pulmonary vein is now divided with a single 30 mm robotic vascular stapler reload. This maneuver allows a clear visualization of the dividing branches of pulmonary artery. Lifting the stump of the vein and proceeding with the dissection of pulmonary artery's adventitial plane leads to exposing of the Boyden branch, which runs parallel to the pulmonary vein on its upper margin. Lymphadenectomy of hilar station 10 is performed, facilitating the dissection of Boyden on its lower margin. When the isolation is completed, the artery is divided using a 30 mm robotic vascular stapler reload. At this point, the lung is pulled anteriorly and inferiorly to access the bronchial structures. The posterior pleural reflection is dissected using electrocautery, exposing the right upper lobe bronchus. Its upper margin is free from the lower margin of the azygos vein with a gentle blunt dissection. Lung tissue is cleared away from the angle between the bronchus intermedius and the upper lobe bronchus, exposing the posterior hilar lymph nodes in this position. The lobe is again pulled posteriorly. An accurate hilar lymphadenectomy makes it possible to dissect the lower margin of the bronchus, which is eventually transected using a robotic stapler mounted with a 45 mm green reload. In this case, the fissures between upper and middle and lower lobe are well delimited. The division is performed with multiple parenchymal reload. Station 7 lymphadenectomy begins by opening the posterior pleura from the superior edge of the lower lobe vein along the course of the vagus nerve. This allows a safe visualization of the esophagus. Paratracheal area is approached by dissecting the mediastinal pleura above the azygos vein and along the lateral profile of the superior vena cava. Station 4R and 2R are removed en bloc. Procedure is completed by pulling the lobe out of the chest with a specimen retrieval bag through a utility incision made by joining the two middle robotic incisions.